My name is Dr. Tushar Mehta. I'm from Canada, and I did my residency there in family medicine. I've also practiced addictions medicine, and I've mostly practiced emergency medicine, or what you call A&E in some countries. I have an interest in international health, and I do work in India and a few other places. And on top of that, I have a strong interest in plant-based diet and health. So when I say plant-based diet and health, you can also say vegan diet and health. And I'm here on behalf of Hina Modi and plantshift.com. Okay, let's talk a little bit now about prostate cancer. Okay, so now let's look at another study, and this is very relevant, and it's regarding soy again, which we talked about with breast cancer in the prior video. And it's called Soy Consumption and Prostate Cancer Risk in Men, a Revisit of a Meta-Analysis 2009 in the American Journal of Clinical Nutrition. So have a look at that one. Now, what it did was it combines the results of 15 different studies and looking at how much prostate cancer there is in people who eat more versus less soy. All right. What they found, again, there was an American group and there was a Asian group of studies. Okay, and in the Asian group of studies, where people consume a significant more amount of soy, again having the higher consuming people having 2, 3, or 4 servings, so it's not a moderate amount, it's a high amount of soy, and they had 50% less prostate cancer if they ate more soy compared to those who ate the least amount of soy. So this was not a study like the Adventist one where we're comparing vegetarians versus meat eaters. This was one comparing people, mostly all meat eaters, but having more versus less soy. Okay, the American group of studies, the Western group of studies didn't show a difference, but they were having very small amounts of soy, and they just think that it wasn't enough to really make a difference. But the Asian group, where they were consuming much more, they found that difference. Here's another interesting study. Eggs, red meat, and poultry intake and risk of lethal prostate cancer. It's a 2012 study showing that basically people who eating more eggs had more death from prostate cancer. Now, the full details are in the references. I'm going to make this a bit snappy, so I'm not going to go through everything. And meat and poultry had a trend towards increased death during that study, but it wasn't enough to reach statistical significance. Now, again, this wasn't a study that included a vegetarian or vegan subgroup, so they're not having a subgroup that has zero amount of eggs, poultry, meat, and so forth. However, they're just comparing people who have higher amounts versus lower amounts, and that's what they found. In many cases, a study like this, if they're having less poultry, they might have more meat, or if they're having more eggs, they might have less meat, and things like that as well. So it's not quite as good as having a study that follows for the same amount of time people who are actually vegetarian. But the interesting thing is that it does quantify the people, because the Adventist and Epic groups made a group of studies that we talked about before, where they do have vegetarian subgroups. The meat-eating groups consume very little meat. But here we have groups that do consume a significant more amount of meat, dairy, and eggs, and we found that there's a difference. Okay. Another study, whole milk is associated with prostate cancer mortality amongst U.S. male physicians. This is 21,000 men followed for 28 years. The study was published in 2012. Okay, and I think the data is pulled from the Physicians' Health Study. So these are guys who are pretty similar in many respects, high socioeconomic, they're all doctors, we're just watching them. And the thing that they're looking at is milk intake. And those who consumed the most milk had 50% more prostate cancer compared to those who had the least amount of milk. Okay, the worst offender was whole milk, so that containing more of the animal fat in it. And low-fat milk did have increased rates of cancer compared to having less milk, but not as much as the whole milk. So skim milk may be better than whole milk. Maybe 2% is, we have 2% milk, maybe somewhere in between there. But, more milk consumption was associated with increased prostate cancer. So few interesting studies on prostate cancer regarding being vegetarian, consuming soy, eggs, and meat, as well as whole milk. All right, take a look at the references that are provided, because there's more studies in there, again, showing similar results, kind of reinforcing the ones that I just presented over here. Thank you. So the references for every single video that I have are going to be downloadable from the description box, where you can click and download the entire set of references, and then just scroll down to the relevant references. If it's a video on diabetes or cancer or something like that, scroll down to the relevant section and take a look at the references that I'm speaking about. In my videos, I'll generally discuss one reference, but it's going to take too long to discuss 10 references and you'll be bored out of your mind. So I'll discuss one, and then you can go into the reference list and look at more references that are talking about the same topic. And it's important not just to have one reference, but to have multiple references that discuss a topic, because then you're seeing that different studies are being done in different places by different people, and they're getting similar results that are reinforcing each other. Okay, so that's another good thing to look at.